Ambulance services, patient breathing.
It's a road traffic accident. They've had a head-on smash.
We've had a report from a train driver. He has come across the body.
The blood's just squeezing out of my leg. Get somebody quick.
RTC!
This is a typical 12-hour shift with West Midlands Ambulance Service.
It's not like a normal job.
Nice and steady.
What's happened then?
In that time,
Stop.
it receives over 2,000 calls for help.
Does she still have the knife on her?
I'm staying right here with you until we get the ambulance there, OK?
From a population of 5.6 million.
You are with people for the best and worst moments of their lives.
Can you lift this leg for me?
Anything like this happened to you before?
You might have broken it, you might have dislocated it.
Filming simultaneously with 7 paramedic crews.
Oh, sounds nasty. Yeah, Roger, we're on the way.
But don't be afraid to call us, please.
This is life on the front line.
And back.
If we don't get to a patient on time, it can cost lives. Radio?
Thank you, sir.
No problems.
It's 6:30 p.m. and the beginning of a 12-hour night shift for the paramedics of West Midlands Ambulance Service.
I love the first night shift.
It's like full of energy.
Yeah, ready to go.
Looks like it's going to be quite a nice night, mate.
Hopefully, yeah. It's been a nice day today.
Ready to go
Ready,
then.
let's go.
Do the first one.
While most people are winding down after a day at work, these crews haven't long since woken up.
Do I still snore as much now I've lost my weight?
I don't notice it now as much at all. I still put my earplugs in.
You snore. You do snore.
Every snorer will deny that they snore.
You know how bad of a snorer that you are? I mean, you do know because I've videoed you and I've told you.
I've had my tonsils out and I don't snore anymore, but I breathe heavily apparently, which is a problem, so I need to stop breathing at night.
Oh God, it's so nice being a proper truck. Oh, I've hated these new ones. This is lovely.
Feels a bit heavier almost, doesn't it? I feel like it's been broken in, you see that?
Yeah. And the steering wheel fits better. I don't like the new chunky ones.
It's small hands, that's what it's like.
I prefer the older vehicles.
I prefer the older vehicles. The new ones, the steering wheel's too big for my tiny little hands.
They feel like a go-kart, whereas the old ones feel a bit heavier and like you could properly drive it, so.
They're broken in.
Broken in, yeah. Yeah, I like the older ones better.
Ambulance services, patient breathing.
It's a road traffic accident. They've had a head-on smash. Need somebody to look at it, really.
Is it possible to speak to her?
Hi.
Are you injured at all?
My chest hurts and my knee, it just hurts to breathe in.
But before a crew was sent to this call, Laura and Joel just happened to be driving down the same stretch of road.
Oh, stop.
What do you see? Okay. Yeah?
I don't know if they're off.
Cancel.
846.
46, go ahead.
Yeah, I don't know if you're currently getting a call for an RTC on this road that we're situated at.
We quite often come across collisions that have happened when we're driving around in the ambulance because we're driving around it so much. I think it's good courtesy to stop and see what's going on. Has someone called for an ambulance? Is anyone really hurt?
This lady was in this red car.
Right, so yeah, and you tell me what's happened.
I don't really know.
20-year-old India was driving her red Beetle back from her job as a stable hand when she was in a collision with a black BMW.
Were you wearing your seatbelt?
Yes.
Good. What speed do you think you were doing?
Yeah, ladders.
30.
Really
First things first, are you hurt anywhere?
Swear to God.
Chest and my knee.
Okay, chest and your knee.
Everything.
Is this your mum on the phone?
Yeah.
Right, first things first, let me talk. Hello, Mum. My name's Joel, just one of the paramedics, okay? Just to let you know. My name's Joel, just one... Okay, listen to me, she's okay, so just take your time.
Whenever someone hears that a loved one's been in an accident, it can be quite traumatic. And for us, the biggest thing is to try and calm them down and reassure them. So it's quite nice that I could talk to India's mum on the phone and give her the reassurance that she needed initially before she drove to India to see her.
Do you think you stand up and get in the back of the ambulance? I think it's a bit easier. Rather than sitting out here, come on. Let's do it. Yeah. Come on and sit down. Rather than like sitting outside, it's all about March really, isn't it?
We're going in this door.
Come on. You okay? Listen, come on. It's okay. Come on. Step up there.
Are you happy on your chair, Joel? Oh, breathe.
Digging up holes again. Tell you what, it amazes me what is under the pavement. When they dig it up and dig an hole, it just blows me away.
Well, apparently, I didn't know this, but there's a diversion off the canal down here that goes into Stoke itself.
Is there?
It's underground. I have little bits of really obscure knowledge.
Yeah.
It just random facts that can apply to the blue. Yeah.
I don't know why, but stuff just pops into your head.
Yeah.
Why do I know that? Have you ever thought, you know, you got like loads of random facts, and I have, about getting a pub quiz team? I'd have started.
I don't think I could do that, actually, because all the irrelevant information that I know wouldn't get asked.
Hi, police, how can I help?
It's a little bit vague this, so apologies in advance. We've had a report from a train driver who has come across the body. Don't know whether they're conscious of breathing, whether they're alive or deceased, or whether they're male or female, or anything like that at the moment.
Train driver has come across a body.
Right, okay. I can see it, if it's on the railway lines, it's probably going to be a fatal.
When you go to a job on a train track, you don't know what you're going to find. They're horrible. And that's all I can say with that. It's just, they're just horrible jobs.
You have reached your destination.
In here?
Yeah, so that's your entrance. The train track runs across the back there, so we can cut across the path. Yeah, 4761. We've arrived at the pinpoint address we've been given.
Mick and Dave arrive at a railway line where a train driver has reported a body. As it's likely to be a severe trauma case, Paramedic Officer Simon has been sent to help.
So there's a police officer has apparently said they're incompatible with life.
Yeah.
But we obviously need to confirm. Confirmed. So I don't want anybody on the track until we've got confirmation that the track's closed. Okay. Right, let's make a move down this way.
Before Mick and Dave can approach the body, the railway line must be made safe. They've been told by the police that the person has already died.
I've got a feeling this is the wrong area.
So the tracks, they've said this is the nearest we can get to it. We can't get down towards the tracks where we are here. There's a fence in the way. There are no British transport here at this time. Can we confirm an RVP with them, please?
Yeah, we're going for that now.
Mick and Dave need to get the ambulance as close to the track as possible, but with a locked barrier, they're too far away.
I can't think, because I know the area, and I can't think of any other point where they can get at it unless it's through the train station.
Yeah. Okay. I'll lock control now.
Okay.
Right.
We'll head
towards the train station.
Have either of you been to incidents like this before?
Not on the tracks.
Not on the tracks.
Have you don't?
No.
Okay. What I propose to do is to save exposing you guys to it. I'll go and have a word first.
Yeah.
And we'll make a decision from there.
Yeah.
Don't know about yourself, but I wasn't 100% knowing what to expect. I sort of had a vision of...
You have a visual idea.
An idea of potentially what carnage you're going to walk into. I know the officer didn't want us to proceed if we didn't feel comfortable with it. I personally think that I needed to go and see it, not out of morbid curiosity at all, but it's just the fact that it's something that
if you come across it again, you know what to expect.
You know what to expect, so you're not going to be taken aback. You know, you've got that vision in your head.
Joint hand with your jumping.
Yeah.
In Stoke, paramedics Laura and Joel are with India, who's been involved in a car crash.
I'm just...
Right, I'm just gonna help get it over your head.
Thank you.
Oh.
Right, I'm pulling.
Right, sit down there now. Right. The delayed reaction of realising what you've just been through is quite a common thing. I think your body goes into like a fight or flight and you don't even realise what's happened. Then as you slowly start to process it, all the emotions hit like it did with India.
So, you weren't doing a great speed. Good.
No, because I had a dog in the pot and I was nervous for it.
Did you? Oh, bless.
Where's your dog?
She's in my friend's car.
That's okay, that's good.
Just relax. You're okay. All right. The pains that you may be feeling is probably from the seatbelts and everything else, okay? And the shock of it all.
I did get crushed by a horse yesterday.
Did you?
Yeah, and I had a bit of pain.
You're in a bit of pain anyway.
Yeah.
So you've had 2 days worth of that, haven't you?
Yeah.
Okay.
While Joel examines India's spine for any signs of injury, Laura checks on the driver of the other car.
Come over here. You've got any pain anywhere?
No. What size is your horse?
I don't have one of my own.
Do you not?
I look after a yard of them.
Do you?
Yeah.
Okay. Just breathe. Okay? Just breathe. You're okay. You look a good colour.
I know, it's just a shock.
It is. That's it. Just relax though. Okay?
Hello.
Hello there.
Having spoken to Joel on the phone, India's mum Tracy has just arrived.
My name's Joel. So come in and sit down. So, all a bit panicky, all fine, okay? Your back feels really good, your chest feels really good, your arms are good, you've been walking, all right?
Switch up.
I think that's the biggest thing, always. So your oxygen levels are 100. So although that you feel like sometimes you feel like you can't get your breath in, you can. You've got it, all right?
Okay. Thank you.
They're free NHS ones, so don't expect like Kleenex or anything. They're not very good, all right?
That's okay.
What type of dog is it?
Bloodhound.
Oh, no. Oh, nice.
She did yell, bless her.
Did
Not
she?
yet.
Oh, have you not?
She's just coming home.
Oh.
An animal lover and everything else up at my house.
Are you? Uh-oh. That's dangerous,
We haven't
that
had a
is.
horse yet come out.
That looks delightful. All in the right place. And this is always a nice souvenir from us to you.
Yay. Look on my corkboard. Or on the fridge.
On your corkboard? Yeah, on the corkboard. Yeah.
To help ease her chest pain, India is given paracetamol.
Okay.
Yeah.
Yeah. So there's two options. Okay. First one, you can take a trip to the hospital. Normally, if it's your bones, it's like excruciating, and you probably wouldn't be able to move.
Yeah.
Or the other option is you go home, you carry on with your paracetamol overnight, and then just give it like 2 days. Take some ibuprofen in between all that, and then see how it go.
I can't move and I can't breathe. I think I'll see how I go.
You're just panicking, aren't you?
Yeah.
You just need to calm down and see how you are, and then we'll figure it out from there, eh?
Yeah. Hospital's always there waiting if you change your mind.
That's it. It's always there.
India was very lucky after this collision in the fact that we could give her some pain relief and it would help with her muscle aches, and then she could go home, have a nice cup of tea and relax rather than having to go in the hospital.
Come on, man.
You okay with the step?
Oh, thank you.
Do you want the step or do you want to put the ramp down?
I should be okay.
I might need the ramp.
Oh, here. For your pen board as well. Yeah. Watch your step.
This knee first.
Yes.
Thank you.
Watch yourself down, Tracy. It is a bigger one than what you think. Bloody hell, woman. You're taller in there. Stay in there.
The police have now closed the road and the damaged cars will be towed away.
Nice job. The main thing is she was okay.
Took me by surprise though. Whenever you're driving up, you're like, I wasn't expecting to just see like a car in front of us. So,
Yeah,
you know,
people waving.
it always catches me off guard.
timing.
Yeah, perfect timing.
In Stoke, paramedics Mick and Dave are trying to find a deceased patient who's been hit by a train.
Because the train station is straight over that way.
Yeah.
I got a feeling that they've gone on at the train station and walked up. Yeah, so that's probably going to be the only, because you're not going to get there. I mean, sadly, it sounds like it's
the person's deceased. Yeah.
You see the police van. Yeah. What?
Is the train line closed off?
It is. We've got a full stop on the line at the moment, so there's no trains.
No trains.
No trains.
Okay.
So, are you happy for us to go down and...
I will do.
Yeah, absolutely. That's not a problem in the slightest.
When you're walking down that track, you're thinking, what has happened? Was it an accident? Did they intend to do it? What was going through their mind? This is something that we'll probably never find out. And it's always something that you could think about, because that person has got to the point in their life where they found no other alternative but to end their life. Okay. So it looks like we've had an impact here. So that's where it hit first, yeah, by the looks of it.
Some keys.
We've got a set of keys here. You're aware? Okay. Yeah. We're just going quite a way, aren't we?
Obviously been hit by a train that's not due to stop at this station.
Yeah.
When we've got to the station, it was evident from where the first point of contact had been made. I was quite apprehensive about seeing the body. It's really hard to describe it. I can't really put into words what you're feeling until you've actually seen it.
So you do your paperwork?
We'll do paperwork.
I just told control that we're going to go back to the hub. We need to do a roll form to leave here with the police officers.
To confirm a patient has died, paramedics complete a roll form which stands for recognition of life extinct.
How can we do roll form and no details?
So what we do is you just
put on unknown.
We'll put my details down as confirming life extinct, and we'll get ourselves
sorted.
Okay.
Once we've been on scene, we've seen the deceased person. Right, reform 12 for you. Who is this person? We don't know. That's passed over to the police to find out. It's down to the police officers then to go across to that person's family and break the news to them that their loved one has passed away under these circumstances.
You okay?
Yep.
Yeah.
Shane.
Why?
Why?
You gotta ask yourself, why?
There's always that question, why? Why would somebody want to do that? Why did it happen? And there is no answers, because you don't know what was going through that person's mind at the time. It's one of them questions that will never, ever be answered.
I've seen some trauma in this job, okay? But that's the first time I've had to deal with a train track. Somebody's been killed on a train track.
Saying that, I've done 19 years now on the service, and it's the same really. I've seen a lot of nasty trauma, but that's the first time I've been onto a train track where it's
hard to process. You know, it's
destruction, isn't it?
It is. I mean, total destruction.
It's gonna be devastation for the family as well.
Oh, absolutely.
Did you know that you can squeeze your weenus as hard as you want and it doesn't hurt? You heard that right, your weenus.
Well...
Do you know what your weenus is?
No.
Do you want to know what your weenus is?
Do I want to know or not?
It's up to you if you want to know what your weenus is.
It sounds like I don't want to know. I think Dan's got a very dirty mind.
Have I?
Yeah.
What? Your weenus is just here on your elbow, that little bit of skin.
I've never really thought to myself, hold on, let's just pinch me out.
What was you thinking instead of weenus, though?
What do you think I was thinking?
I absolutely love winding Ellie up. Like, I think I get better job satisfaction out of just winding you up. It's the most amazing thing to do.
I think I'm so gullible as well.
You are, yeah. I could literally tell you anything
easier.
and you would believe it, and that's the thing. And when I want to, I can really act well and make you believe anything I tell you, which adds to it.
Ambulance, is the patient breathing?
No, yeah.
Is the patient conscious and awake?
Sort of.
Is the patient's breathing noisy, abnormal?
Really abnormal. He's got pain across his heart as well.
Okay. Has he lost any blood?
Yeah, he vomited blood this afternoon. He fell down the stairs earlier as well.
Right, so we've got 30-year-old male having chest pains and vomiting blood, fighting for breath, onset of breathing problems, pain in abdomen. PT has fallen down the stairs from top to bottom. When all this information come through for this job, it was quite confusing as to what the actual problem was, as it was coming through that there was pain in several different areas. Hiya.
Dan and Ellie are met by a family friend.
Lovely. Hello. Is it Scott?
Yeah. Oh, right, Scott, my name's Ellie, this is Dan. What have you done today?
I don't know, I've got a horrible pain against my heart.
Horrible pain, OK. Did you fall down some stairs today?
Top to bottom.
Top to bottom, full set?
I had a dizzy spell, I missed the top step and went...
30-year-old lifeguard Scott has fallen down the stairs and now can't move.
Where are the pains?
Bottom of the back there.
So, bottom of your back, and then...
I've got, it's almost like a stabbing pain on my heart.
Stabbing pain in your chest. Scott was clearly in agony, and due to him rolling around the sofa, we needed to know what extent his injuries were. Have you had any pain relief or anything for it?
No.
We'll just have a quick feel of your central spine, just because obviously the mechanism, we might have to put a thing on if it's in the middle. Oh, crikey, is it there? Yeah. Oh, right, OK, that's not very good if it's right there. Okay. What about up here? Any movement, there is the risk of paralysis.
As the West Midlands sleeps, we're on board with 7 paramedic crews simultaneously as they work a typical 12-hour night shift.
Is that painful there?
In Walsall, paramedic Dan and student paramedic Ellie are with Scott, who's fallen down the stairs.
Before we get started, you're going to have to be boarded.
Yeah.
Scott's condition was potentially life-changing, given that he had central spinal pain. It could mean that he never walks again. So it was vital that we came up with a safe exit plan to get him onto the ambulance without causing any further damage. I know that you've obviously moved from the injury, but the main priority now is to try not cause any further damage.
It's weird, normally I'm telling people to stay still. I work as a lifeguard.
Yeah, you were kind of used to it, yeah.
Don't move, keep your head in this position, and now it's role reversal.
Yeah. We'll just run that paracetamol through first, and then obviously we can upgrade it after this anyway.
Dan places a cannula in Scott's arm, so pain relief can be given intravenously.
So I'll give you some gas and air, just to help with this part. Helps with kind of the spasms and kind of the traumatic kind of pain. All right, not too fast, but nice deep breaths. With every breath you take, nice deep breaths.
Dan and Ellie need to place a rigid board underneath Scott, so they can lift him up without damaging his spine.
Literally, you just tell me when and we'll roll. We'll roll on your count of 3.
Yeah, right, then after 3, we're going to roll towards the sofa. You ready? 1, just nice and easy, 2 and 3. Perfect, lovely, lovely. Just nice and still.
Not going to go. Rip your set. Right, we're going to be too high.
Okay, and then come back to the neutral.
It was difficult to get the board under Scott because he was lying on the sofa and there was armrests either side that were higher than the actual sofa, and our board is quite long, so either end of our board were resting on the sofa arms, which obviously meant we couldn't get it down low enough to get under his bum and get flat, so that was difficult to try and get him on that way.
The only other option we're going to have to do, because you've already stood up, is I'm going to have to hold your head and we're going to have to see if we can get you onto this board if we clip it in. Does that make sense?
Yeah. After falling down the stairs, Scott moved himself onto the sofa, so Dan knows he's at least able to safely sit upright.
Just take it easy. 1, 2, and 3, and let's just generally sit up. That's it. Keep going on the gas now, because that should help. And just keep your head straight without bending down.
Dan keeps Scott's neck straight while he tries to sit up.
That's it. And then after 3, get your bearings again. Yeah. 1, 2, 3.
There you go. That's it, you're all right.
You're okay.
You're all right.
That's it.
Nice, slow, deep breaths. Try and concentrate.
2.
That's it, go on, you're doing great.
3.
Right, step
Right there, let me
coming
move
off.
the... That's it, go on. Right, that's it, step down, careful, that's it, take your time.
Nearly there.
That's it, just go and lean on me. That's it, you're doing great.
If we lie you back.
Slowly lie.
It's not going to be comfortable, but just lie down. That's it. Perfect. Lovely. That wasn't too bad, actually. And this is just a nice, easy one, all right. So nice and steady. A bit of a bump.
Yeah.
We're in.
With Scott safely on the ambulance, Dan and Ellie can carry out their observations.
If you've got to cut the jumper, cut the jumper. It's a battered old jumper, that. It's back to racing days.
What do you mean racing? What did you used to
Banger
race?
racing.
Banger racing?
Stocks and Derby.
So you used to just drive stuff to crash it up, basically? I feel like banger racing is quite dangerous, and he seems a bit like of an adrenaline junkie, like me and Dan, but I don't think he'll be doing it anytime soon, as he needs to rest.
Just going to have a quick feel of your tummy as well, all right? Is that painful there?
Yeah.
It's quite painful everywhere, isn't it? Obviously, if he's come down the stairs, it's most likely going to be kind of potential fractured rib, maybe. It could just be quite sore and muscular kind of pain. But there's nothing kind of showing like a cardiac.
Scott's ECG is normal, but he's complaining of pain all over his body. So Dan gives him morphine.
I'm sure that's not too tight on you. Just in the back of the vehicle. We're going to the hospital.
Let's roll.
Let's roll. I've not heard that one for a while.
It's a short 5-minute journey to the nearest hospital.
2 minutes ETA, Scott. That's 2 minutes for you.
I really need to put you two forward to somebody and say that you're amazing.
Oh, bless you.
Scott arrives at Walsall Manor Hospital.
Right, you're doing really well, Scott. We're just going in now.
In A&E, he'll be examined by the trauma team to check if his spine is damaged and to see if he's fractured any ribs.
If that was the case, like, he was very lucky that his injuries, like, obviously I know that he was suspecting kind of spinal injuries, but like it could be a lot worse in the sense of like unconscious or like an obvious break, yeah.
As with Scott, when the worst happens, we all ring 999.
Is there a threat to life, limb or sight? Blood all over the floor and up the wall.
When we're panicked and distressed, it's the call assessors on the end of the line that we rely on to get us the help we so desperately need.
You need to be confident with speaking to anybody on the phone. You also need to have good communication skills and active listening, because you need to pick up everything that the caller is saying.
Ambulance next. Patient breathing.
I'm not sure if he's been stabbed. It doesn't look very well.
He's been stabbed. Are you with the patient right now?
No, I'm working. I was looking on the cameras and I just went out to see what was going on.
Are you able to go outside for me now, please?
Yeah, but see.
Yeah, if you can just take the phone outside for me, please.
Yeah, one sec.
Just let me know once you're outside, okay?
My first thoughts when hearing the patient had been stabbed was that it was stressful, that we needed to make sure we was getting the help arranged in a timely manner and making sure we're giving the right care advice out to the patient.
Can you hear me now?
I can hear you now. Okay, so has he lost blood?
Yeah.
Is it heavy blood loss?
He looks pretty heavy, yeah. He's close.
Okay. Where's the patient been stabbed?
In the back.
Okay. And was it by a knife? Do we know what object it was from?
Do you know what he was stabbed with? Was it a knife or a knife? A knife.
Okay. Are you still with the patient?
No, I'll come back inside. He's out there with a couple of friends.
So use a dry dressing or a clean cloth folded into a
he's just
pad.
gone out there to do it.
Perfect. Press firmly and directly onto the wound, okay?
Yeah.
Just keep the blood off your skin. So we have got the help arranged, and
All right.
we don't know if the attackers are still on scene.
No, we don't know. I don't think so.
Okay. So get someone to meet and direct the vehicle once you can see them outside. In the meantime, if the patient has any new symptoms, the condition gets worse, changes, or any other concerns, please call us straight back on 999, okay?
7 minutes later, a crew arrived to treat the patient. This is just one of the 4,000 calls West Midlands Ambulance Service receives every day, with the next 999 call only around 17 seconds away.
Ambulance service, is the patient breathing?
Yeah, the blood's just squirting out of my leg. Spurting out in a straight line.
Would you say that the amount of blood that you've lost would fill 2 or more mugfuls or less than that?
A mugful. Just get somebody quick.
The job gets passed to Mick and Dave.
Right, we are off to an 83-year-old gentleman with a bleeding wound, spurting or spraying from the wound. Leg or foot wound.
Varicose vein?
It does sound like your typical varicose vein symptom, doesn't it?
It does.
Spurting.
En route to the job, we were given it as a bleeding wound, which was spurting, which for us is a good indication it's a varicose vein. It's a vein that's ruptured under pressure and it contracts and pumps out with the heartbeat. It's time critical really. We get there, we apply pressure and stop this bleeding for them. You reckon this one?
I think so. 24.
Son-in-law Adrian is waiting outside for the paramedics.
Hi. Right, what have you been up to?
Right, let's get a look at that and I'll see what's going on. My name's Dave, okay, and that's Mick.
Squirting out, lad.
It's squirting out, yeah. Well, I need to have a quick look and then we can get some more pressure on it, all right?
83-year-old retired storekeeper Graham is with his wife Margaret. His daughter Lynn has applied a dressing to try and stem the bleeding.
Has anything like this happened to you before?
No.
No. Do you feel faint or dizzy at the moment?
No.
No. All right, let's have a little look then.
The scene was pretty horrendous. He'd obviously been walking around and whilst doing this, his blood has splurted everywhere. It was up the walls, it was all on the floor.
It does look absolutely horrendous. Well, at the moment, it looks like it has stopped.
In Stoke, Mick and Dave are with Graham. He's ruptured a varicose vein in his leg, which has bled severely.
Whereabouts was it coming from?
Somewhere here.
Just around about there.
Side.
So it may be there. So it definitely sounds like it's a varicose vein.
In a healthy vein, tiny valves stop the blood from flowing backwards. If these weaken, blood collects in the vein, causing it to swell.
So with varicose veins, especially in the elderly, they become quite weak. And with the pressure of the blood returning back to the heart, this is what can cause them to burst.
So we'll just get you wired up to my machine and make sure everything's all right. And then what we will have to do is obviously move. Okay, and then we'll see whether any pressure goes and causes it again. So what were you doing when it happened? Were you dancing with the missus?
No, I think I just rubbed my leg there.
You just don't rub it anymore.
No.
That's okay, don't worry. I know he's your hero. He's your hero, ain't he?
So I'm being survived.
Oh, absolutely. Yeah. Sorry, you got to buy the missus another anniversary present.
Look at me, lad. It's a serious affair, this is. I thought it was being bleeding.
It's like a bloodbath.
No, it looks a lot worse than what it actually is.
Panicking a bit, you know what I mean?
You go into it, it looks horrendous. It looks like you've been in a massacre. You know, that's the best way.
That's the best way.
That is the best way to describe it, because because of the pressure. Are you ready? Okay, steady, slow and steady, okay?
Dave checks that standing upright doesn't place too much pressure on the vein, causing it to open again.
Don't feel dizzy or anything like that?
No.
All right, have a pew down again for a minute. I think that's clotted it really well. It's not leaking again, it's not altered in any way, shape or form from when I first looked at it. Right. So I think, hopefully, it's clotted itself and it doesn't need any intervention from ourselves. Okay? Oh, watch out, the wife's here now. Do you know all them nasty things you said about her? She's got a cane in her hand.
It was lovely when Graham's wife came out and gave him a kiss. You could see there's so much love and affection there. It just gives you a nice warm feeling inside. You know, it'd be nice if I could have that when I'm 80.
How long have you been together?
Too long.
You only said that because you forgot, didn't you? Oh, I'm not saying it. 58 years.
Oh, nice. And happily married first 12 months.
So you can take this off in the morning.
No dancing tonight.
No dancing tonight. Just take your time when you're moving around.
Thank you so much.
That's okay, not a problem. It's been a privilege to come out to such a nice gentleman. Yeah. Are you okay?
Yeah. Thank you ever so much.
All right.
Okay,
take care then. Any problems, give us a ring back, all right? Okay, bye-bye.
Bye-bye.
Well, what a really nice chap.
They were nice.
Nice family, nice family.
Yeah.
Glad it was nothing too sinister, too serious. You know, we sort of guessed it was a varicose vein, but it doesn't half spray. Because, I mean, that venous pressure, it's...
Had a right variety of jobs between us. My favourite was running pubs, but that's a different world to how pubs are run now. I used to run pubs and I absolutely loved that because of the chatter.
You still like chatting?
I love chatting.
You chat for the both of us.
I think in our job and running pubs, you have got to be able to talk to people.
Yeah.
It's part of the job, isn't it?
Are they calling about yourself or somebody else today?
Somebody else.
Are you mum?
Yes. And there's moments where he seems to have a big pause between some of his breathing, and then when he starts again, he's a bit panicked.
Is his chest and upper tummy being sucked in with every breath?
Yeah.
Zero 5.
Simon Cole, twice the breath. Keep over.
Received.
Oh. I've had a kiddie for a while, have we?
Okay, so a 9-month-old boy who has had some breathing problems while asleep. Panic.
No one ever likes going to a child that's fighting for breath. It puts the fear of God into all paramedics.
Hello.
Hi, Mark. This is Sarah.
I'm Jen. This is Ryan. This is Hunter. And what's been going on with Hunter?
Well, he's started nursery. So he's caught like
everything.
Yeah. With his breathing, there's moments where he'll take about 10-15 second gap in between like his breaths, and then he panics, does like arm fluttering, and then goes back to normal again.
A quiet child is never a good child. A screaming child is always what we want. We'd arrived, he wasn't awake, so I was concerned at that point.
So is he your first?
Yeah.
Is this the first time he's been ill?
Yeah.
You're dying, aren't you?
Yeah.
When you become a mum, especially for the first time, and your baby's poorly, it's terrifying for them. So, as well as dealing with the patient, we have to keep mum calm.
Sounds look really good.
You snore as bad as me, Hunter.
Like Auntie Sarah.
It is snoring.
We're married, so I know that she snores. One thing that you probably won't know about kids is that up until the age of about 2, they're what's called nasally obligated. They don't know that that great big hole in the middle of their mouth can breathe through it as well.
Okay.
And if they're snotty and bunged up, they breathe through the nose up to the point where they can't really breathe anymore, and then the body goes
Okay.
and frightens the life out of you.
Yeah.
With Hunter breathing normally, Mark listens to his lungs and heart.
Just going to do an ECG on him because he's got a bit of an irregular heartbeat. But
That doesn't mean there's anything wrong. Don't panic. Listen,
could be
don't
lots of
panic.
reasons for it.
Don't panic.
When bear cubs are not very well.
I'm
she's
horrendous,
lousy.
yes, I'm like you. And he'll go, you're a paramedic. Oh, yeah, I am. Hang on a minute. As a mom, if my children are ill, I'm not good. That's when I rely on Mark to take over because I'm like that. I panic, as any mom would. So it's not paramedic, it's mom mode. Mate, you like me. Honestly, you sleep through anything. I'm just the same.
You're bomb-proof, you are, aren't you?
Yeah.
Mark runs an ECG to check the electrical activity of Hunter's heart.
There's nothing sinister on there, but it is irregular.
Okay.
Finding out that Hunter had got an irregular heartbeat is quite concerning. It could be a sign of something that needs further intervention at a hospital. That's the problem with our job. We go and find things that sometimes people don't know about, and that can be quite distressing for all concerned. I think you've got an infection of some form, but just on the basis of just this irregular pulse, I'd like to take him up to Stoke and just get him checked over.
Okay.
Hello. Hello.
With such a young child, Mark and Sarah are limited in what they can diagnose. Hunter needs to be seen by doctors in hospital.
Mum, do you want to come up on here because it's a bit warmer on you? WIs all across the country, Women's Institutes, have been making bears for paramedics to give out to little ones. And we don't come across many little ones.
Look, Hunter. He's more interested in you. Look. Who's that?
Oh, there you go, look.
Look.
A short while ago, Women's Institute groups started making knitting teddies. Some people call them trauma teddies, various other names, but they're a really good tool for us. Kids like teddies, but using it as a distraction technique allows us to do our job a lot easier if the kid's looking at the teddy, not us. Come on, little fella. Let's pop you on here. Oh. Yeah.
Yeah, that's what I think of Rupert.
Typical.
Dad Ryan will make his own way to hospital.
Ready when you are. Oh, that's a big yawn, Hunter. You're gonna have a nap soon. Nurseries are just a germ fest and they enjoy it.
You know what? He had one day, he had like a settling in day where he caught this initial thing from. So for the last 3 weeks, he's always been dealing with it. Honestly.
It's a nightmare. It does help build the immunity up though, that it's always it does, honestly it does. But you have to ride the rough road with that. They are lovely when they're like this though. No, it's just the stress.
It's not long before Hunter and Mum Jenny arrive at Royal Stoke University Hospital.
Do you want to take him and I'll sort the stretcher out?
Okay, love.
Here, paediatricians will treat his infection and investigate the cause of his irregular heartbeat. In hospital, Hunter was treated for a virus and discharged the same day. The cause of his irregular heartbeat was unknown. Scott, who fell down the stairs, had a CT scan. This found a fracture in his lower back. He was given pain relief and was off work for 3 months. And India, who was involved in a car accident, had her car written off. Finding the confidence to get back behind the wheel was a struggle.
At the start, I was quite nervous. Like, people pulling out would really scare me. But now I'm good now. Got a new job, got a new car. I'm a lot easier and better driving than I thought I would be. Raven, come here!
And the bloodhound who was in the car with her, thankfully, wasn't hurt.
When the accident happened, she yelped, so I was quite scared for her. I remember she slipped out from behind my seat and she tried to run up the road, and my friend caught her. But yeah, she's not injured or anything and she's doing really well. I'd just say a massive thank you to the paramedics. They made it so much easier, so much more comfortable, and a lot less scary.
Next time.
He is obviously bleeding with clots, and we don't like that. It's not very good.
An elderly man is bleeding heavily.
He was quite pale and he was breathing very hard. This can be a sign that his body's compensating for blood loss.
A woman is in agony after falling in a supermarket.
Try and keep it as still as you can.
Could well have been the humeral head that had either fractured or she'd dislocated her shoulder socket.
And paramedics are called to a road traffic collision outside a school.
How do you feel now you've moved?
Trembling.
Trembling, OK. Let's get you in the warm.
A fracture to his neck or spine can cause life-changing injuries.